All right. So what do you guys think? Do we start right away, because we can't be having our elders with us and then we're delaying, right?
Yes, ma'am.
No problem.
We have our Baba Tomori with us. Yeah, so it's 8 o'clock, so we begin. So, distinguished policymakers, senior officials, partners in health, security, researchers, students, caregivers, and everyone here present, you're welcome to Cheap Talk Africa. Enough is enough. Lassa fever at 56, and the urgent need to transform decades of data into real action. Is it echoing, or is it just me hearing echo?
It is, ma'am.
It is echoing. All right. So it means that, excuse me just a second, please. I will just sign out of my phone and just use just one system. But it's no more echoing.
It just started.
Oh, it just started. Okay. I just want to make sure that we get the full opening statement so that we can also get to answer Professor Tomori's question. Okay. Okay, I'll just sign out of my phone.
And now we can't hear you. There's no audio on your end.
Okay. So I'm back again on the phone because when I put off my phone, Zoom, you couldn't hear me. Can you hear me now?
Yes.
Very well.
Okay, so I'm just going to continue with the phone and hope that there won't be echoes. So once again, we're welcome to this, welcome to Cheap Talk Africa, February edition, titled Enough is Enough. Lassa fever at 56, and the urgent need to transform decades of data into real action. Now, for over a century, 5 centuries, we have generated robust evidence on transmission patterns, seasonal trends, hotspots, diagnostics, and care pathways. Yet morbidity and mortality persist, and the burden remains concentrated in familiar terrains or geographies. This is a solvable problem, not an inevitable one. So, before we proceed, please just join me to observe a brief moment of silence for Dr. Salome Oboyi, the senior registrar from Bingham University Teaching Hospital, who recently died after contracting Lassa fever in the line of duty, and for all the frontline health workers who we have lost in similar circumstances. Please, can we just pause for 10 seconds just to honor these people? Thank you very much. May their service compel our urgency. So once again, good evening, everyone, and welcome to the special edition of Chip Talk Africa. Chip Talk Africa is a monthly dialogue which we began middle of last year to discuss pressing issues within the premise of CHIP mission. CHIP, Professor Tomori asked, I think this is the third time he's asking, why CHIP? Why CHIP? Because the spelling is, CHEAP. But we know that it is said prevention is cheap compared to cure. So our aim is that whatever we're doing, at the end of the day, we make disease prevention the order of the day, not waiting for disease to come in and then we start struggling to control or to treat. So CHEAP Talk Africa, CHEAP means Community Health Enhancement Aid Project. It has a vision for a resilient, healthy communities. The vision of resilient, healthy communities, health across Africa. So sorry, I keep getting this. I'm supposed to have another meeting at this time. So it keeps interrupting on WhatsApp. So it keeps the call keeps interrupting. So the mission of CHEAP is to promote One Health, empower local actors, and tackle zoonoses, poverty, climate threats. And this CHEAP is actually an initiative of War Against Rabies Foundation, a charitable organization which I founded and registered with the CAC, Corporate Affairs Commission in Nigeria since 2017. So on Chip Talk Africa, we have had very engaging conversations with Africa's notably knowledgeable, resilient, influential, active, just name the adjectives, very relevant scientists, policymakers across Africa, or who work in or with Africans. So far, we have had experts from Namibia, Tanzania, Sierra Leone, Ghana, Nigeria. Our audience is global. The program is young, but growing. Today's conversation is not just another dialogue. It is a call to conscience, a call to courage, and a call to action. For 56 years, Lassa fever has remained one of West Africa's most persistent and deadly public health threats. Year after year, we gather data, we publish reports, we mourn preventable deaths, yet the cycle continues. I'm really so happy that we have Professor Tomori here because, oh my God, I attended the first Lassa fever conference in Abuja and I was so, let me use the word blessed, just listening to talk about Lassa fever, and his passion is palpable. We know what works in Nigeria. We know what doesn't. But data without action is just documentation, and documentation without implementation is a betrayal of the community still living under the shadow of Lassa fever. And really, this echoes the hard cry of Professor Tomori. Tonight, we say enough is enough. This platform, Chip Talk Africa, was created to bridge the gap between knowledge and real change. And today, we bring together experts, practitioners, and leaders who have lived this battle from the front lines. And that's why we have also Professor Chundung Miner, a community medicine professional. Our mission tonight is very simple, yet urgent, to examine why, after 56 years, Nigeria and West Africa are still fighting the same viral enemy. And more importantly, what must change now? Lassa fever should not be a generational problem. It should not be an annual headline. It should not be a normal part of community life. Not after all these years, not with the expertise we have, not with the tools available, not when every delay costs more lives in Africa and other places. So as we begin this conversation, I ask all of us, the panelists, Professor Miner and Professor Tomori, the participants, you and I, the citizens, advocates, policymakers, students, to come with honesty, to speak with courage, and to think boldly. The time for transformative action is now. Welcome to the conversation where we finally turn decades of data into decisive action. Welcome to Chip Talk Africa. And now I hand you over to student Dr. Abubakar Adamu and our Dr. Jennifer Namdi Ibe, who are going to moderate this meeting. Thank you very much for being patient and joining us this evening. So, Jennifer Abubakar, you have the floor to moderate this program. Thank you very much.
All right.
Thank you very
Thank
much,
you very
ma'am.
much, Prof. Grace. Here, the convener of tonight's distinguished professors, respected experts joining us from Nigeria and beyond. On behalf of the organizers of Chip Talk Africa, the One Health Dialogue, I welcome you to this special edition. Just like Prof. Grace said earlier, enough is enough. Lassa fever at 56 and the urgent need to transform decades of data into real action. With us tonight, we have two distinguished panelists with us, Prof. Oyewale Tomori, globally renowned professor of virology, and Prof. Chundung Miner, a community and environmental health consultant and public health leader. Can we kindly welcome them, appreciate them? They are two distinguished panelists we have tonight, and we would be having this conversation, interesting moments with them tonight. Ladies and gentlemen, I present to you our two most important guests here tonight. So we'll be starting by taking their citation. So I'll call on my co-moderator, take the citation of Prof. Tomori, then I will take Prof. Miner, then we'll go into the session properly. Thank you.
Thank you very much. Good evening, everyone. Taking the citation for Professor Oyewale Tomori. Professor Oyewale Tomori is a distinguished Nigerian virologist and one of Africa's foremost authorities on Lassa fever and other viral hemorrhagic fevers. Born on February 3rd, 1946, he earned a Doctor of Veterinary Medicine from Ahmadu Bello University and later a PhD in virology from the University of Ibadan, where he became a professor of virology in 1981 and received international recognition for his pioneering work on Lassa fever. His early research at Rockefeller-funded arbovirus units in Ibadan was central to Nigeria's foundational understanding of Lassa fever following early outbreaks, shaping his lifelong contribution to viral diagnosis, surveillance, and outbreak response. From 1994 to 2004, Professor Tomori served as the regional virologist for the WHO Africa region, where he oversaw viral hemorrhagic fever surveillance and strengthened laboratory capacity across the continent, critical to Lassa fever detection and control. The former Vice Chancellor of Redeemers University and past president of the Nigerian Academy of Science, he has served on numerous high-level advisory bodies, including WHO, SAGE, Nigeria's Expert Review Committee on Polio and Global COVID-19 Vaccine, and outbreak response committees. Professor Tomori is a recipient of Nigerian National Order of Merit, and has authored over 160 scientific publications. He remains a respected voice in One Health, epidemic preparedness, and viral disease control, bringing unparalleled insights to discussions on Lassa fever and West Africa's public health landscape. Welcome, Professor Tomori. Thank you very much for honoring our invitation, sir.
Thank you very much, Dr. Jennifer, for that wonderful citation of Prof. I will be taking that of Prof Miner now. Prof Chundung Miner is a professor of community medicine and environmental health and a consultant community health specialist in the Department of Community Medicine of the University of Jos and Jos University Teaching Hospital, Nigeria. She holds a medical degree and a Master of Public Health from the University of Jos, a fellowship in community health from the West African College of Physicians, and certificates in leadership and management. Several certificates also in air health, to name a few of them. She is involved in lecturing of undergraduates and postgraduate students, provisions of clinical service, training of resident doctors, and research with over 50 publications in local and international journals. Her professional interests are in epidemiology and environmental health. She is currently the Deputy Chairman, Medical Advisory Committee, and the Chairman of the Plateau State branch of the Association of Public Health Physicians of Nigeria. She is also a member of several professional bodies, such as the Nigerian Medical Association and the Medical Women's Association of Nigeria, amongst others. She is happily married with children and enjoys involvement with community development projects and outreach. Ladies and gentlemen, join me as we welcome Prof Miner Chundung. Thank you for joining us and thank you for honoring our invitation, ma'am.
Thank you for the warm welcome.
All right, thank you. So we'll be starting properly now. And this session is going to be a very, very interactive session. It's not a session where we'll be having them presenting to us and we listen. We have drafted questions, strategic questions to ask Professor Miner and Prof Tomori tonight, and we'll be taking them step by step. So to the audience and the participants, please pay attention, enjoy the session. Draft as many as plenty questions you can. After the interactive session, we'll get to have a session for questions and answer where we'll get to engage you all. So starting with the opening question for the two panelists. Lassa fever has been known for 56 years. Why are we still experiencing recurrent outbreaks? And what critical gaps remain unaddressed? In 1 minute each, Prof Tomori and Prof Miner would want you to just help address that question. Lassa fever has been known for 56 years. Why are we still experiencing recurrent outbreaks? And what critical gaps remain unaddressed? So we'll be starting with Prof Tomori, after which Prof Miner will take the question. Thank you.
Thank you very much. I'm not going to show you slides, but I'll make some comments to answer your question. To set the matter in its perspective, the first thing I wanted to observe was that on February 18, 1970, a physician died after performing postmortem on a fatal case of a disease which was later known as Lassa fever. At that time, they didn't know what the disease was. In February 2026, 56 years later, another physician died after operating on a case later confirmed to be Lassa fever. This happened in the same hospital with a change in name and in the same town. It used to be Evangel Hospital. Now it's Bingham. So I think that set the situation in motion. I also wanted to point to the fact that since I have figures, since figures of Lassa fever cases started with about excuse me, we have about 300 cases reported in 2017, climbing gradually to 1,198 by 2020. We had a drop in 2021, not because the Lassa stopped, but because COVID took over the whole place. But then soon after COVID, our figures started rising again, 1,000, over 1,000 between 2022, 23, 24. Up till last year, we still have over 1,000. This year, up to the first 5 weeks, we're already moving on to 1,000. So the problem is, I mean, we have the problem that we with us every year, every time. And the reason for it is simple. We are not a serious country, pure and simple. The things that we should take important, we are not taking important. The thing we should regard as of essential to the life of our people, we don't consider it important. And I've always said it. I remember somebody asked me a question, why have we not done it? I said, because the fault is for Lassa virus, not for us. If Lassa strikes Aso Rock today, if it strikes the National Assembly, if it strikes the judiciary, Nigeria will do something about Lassa. But it has not touched the people who think they're important, and that's why nobody takes care of it. It's something that occurs every year. We know it's coming, but we never get prepared for it because it's not affecting those people who think they're important in Nigeria. Pure and simple. We are not a serious country. We see a problem, we don't take care of it. And that's the same thing when people tell us you are resource limited. That's the most silly statement to call us. We're not resource limited. We're resource squandering. We're resource wasteful. And that's where we are. If you don't know your problem, then of course you never find a solution. Let me stop there for my sister to add on.
Well, I think I'm quite honored that Prof Tomori will call me his sister. I'm glad to be on the same platform with him because I didn't imagine that I ever would. I mean, it's a name that is so well known. So I think maybe I'll just bring a little bit more focus to what Prof is saying. I view it that there are kind of three main areas that have remained unaddressed. The rodent population, the environmental situations that allow the rodent and the virus to continue to thrive, and then human behavior. And if we do not address these things aggressively, there is no way that we're going to control Lassa fever. The story he was giving regarding the death of the doctor sound like the stories that we hear every day today. And as he said, every year we hear those same stories. We have one, of course, that is very recent. It was still a doctor who operated on somebody who had Lassa fever and then contracted it herself and eventually died. So these stories keep recurring. But I see that the gap remains in the way we are handling those three areas which need to be aggressively handled. And unfortunately, we need help, governmental help, and there's a reason why the people affected are the people affected, which I'm sure will come out during the presentation or during the discussion.
Thank you very much, Prof. It was insightful just answering the first questions. Now back to you, Professor Tomori. So one of the things that we've noticed is to find out if there are surveillance and laboratory systems that are keeping pace with Lassa virus and its changing epidemiology in Nigeria, as it were, and maybe by extension in Africa.
So is that for me?
Yes, sir.
Yeah,
I can take the question again.
Please do.
Okay, so are our surveillance and laboratory systems keeping pace with Lassa virus and its changing epidemiology? That is in Nigeria and by extension, the whole of Africa.
But you see, let me also, I'm going to be talking from kind of experience. First of all, yeah, we have some kind of surveillance going on. The surveillance that we have, not just in Nigeria, in Africa, is that we don't make full use of the data we get from our surveillance. We don't sit down to analyze them and find out more. And let me give you one of few examples. Every year, we report like about 10,000 suspected cases of Lassa. But what happens? Our labs, NCDC and all that, We'll only tell you we diagnose about 1,000, I told you 1,000 cases are confirmed. So we only diagnose about a tenth of that. A very serious country, various people that looked at surveillance will have done a proper analysis of all those data. How come only 10% of what we suspect to be Lassa? Doctors come in and say this is Lassa, others come in and say this is Lassa. It gets to the lab, and only 1 out of 10 is confirmed of Lassa. The question, we've been asking the question, the remaining 9, what are they? That's where, where you something else. What is it? If it looks like Lassa and you say it's not Lassa, then what it is? And that's what our NCDC should be for, into research and other things. It's not just collecting samples, finding positive, negative, and all that, and then filing it up. Well, every year people keep dying. There must be some analysis of the data, whatever information you have. Why? What are the reasons? What are the questions? Are we collecting the right samples? Are we getting the samples that we should be getting? How come we're only able to diagnose only 10% of whatever it comes in? That's what you call about good surveillance. Surveillance is not going to the field and monitor and looking at the cases and seeing all that. In any case, our surveillance should actually be to preempt an epidemic. And that's one of the things I always talk about when we NCDC, National Center for Disease Control. Their full name is not National Center for Disease Control. Their full name is National Center for Disease Control and Prevention. We're copycat. CDC Atlanta does it, so we might just copycat. We can't think seriously about what to get the name. I would have loved a name like National Center for Disease Prevention and Control, so that we focus on the prevention. And because we don't focus on the prevention, we're waiting for the control, that we don't look at the data we have, analyze this properly, and move on and find out the reason how can we use that to prevent the problems that we're having. Over. Over.
Thank you very much, Prof. I don't know if it's just on my end, or can we all hear Prof very well? It seems to be breaking on my end.
It's very clear.
It's very clear.
Oh, okay. Okay, so probably my network. Just to follow up to that, Prof, sir. So for other diseases, we see vaccine being developed and all. So would like to know, sir, if what are the biggest scientific or structural obstacles slowing down vaccine development and early detection, especially when it comes to Lassa?
Well, again, I guess the word when I said we're serious in this country. If we consider Lassa fever a major problem, we will find a vaccine. See what happened with each of the diseases where you found vaccines. Yellow fever, malaria, they're not the problems of the Western world. So it took forever to find the vaccines. But when COVID came, what did it do? It affected them even more than it affected us. And the vaccines came here in a second, because they regarded it as important. Until we in our own different countries, they're not going to make vaccine for you when it's not a problem for them. It is us that will make up our mind as this is a major problem for us. This is a national emergency, and let's work towards getting a vaccine for it. That's the first point. And then for us in our own different environment, when I talk about seriousness, it's just looking at the welfare of each soul that dies of Lassa fever should affect anybody wherever you are, the families that are affected and all that one. And I've had friends I know who have died of Lassa fever, and I can never forget those kind of things. But if that passion is there, if that national passion is not there, for us to look at it, we will never find the vaccines, because we are waiting to donors to do it for us, what we should be doing for us. And I keep stressing, don't go around telling anybody we're a poor country. We're not poor. The number of these things you see on EFCC and when you see, we have money in this country, but we're just not using it properly. Over.
Thank you very much, Prof. And lastly, for this session, sir, what lessons can we get from COVID-19? Can Nigeria immediately apply for Lassa fever control? Since you mentioned COVID-19 earlier, so what lessons did we learn there that we can apply immediately for Lassa fever control in Nigeria, sir?
Actually, Do we learn any lesson as a country? I'm just asking. Let's be frank with ourselves. What lesson did we learn? Or maybe we learn lesson. Which lesson have we forgotten? That's always the situation. These things come and go. I mean, you shouldn't look at COVID to learn a lesson. We have Lassa with us every year. There's enough lesson to learn from that. Now, what happened with COVID? Because there was international concern. If COVID had been an African problem, then we would have just died and forgotten about it. So the thing is that taking things seriously, looking at every disease. You remember when they talk about health not being a revenue yielding, whatever. The lesson I think we learned that one disease wipe out all your revenue. If we put that at the back of our mind, that the disease and coming, all the GDP that President Tinubu is talking about, and all the rising, whatever, Naira moving against whatever, one disease will wipe out all the Naira that you have. And we need to get that message out to our people that, it is just one disease we need to bring us back into recession and into poverty. That message must go on the people. And we never know what disease is going to cause it. So we must be prepared for every disease that as you know, especially the one that is selling us, the one that is killing our people. And every year, it's like a broken record. Lassa fever, technical working group, everything. That's what we do. The rain season will come and wipe out all the thoughts about Lassa fever until the next dry season. So we must be consistent. We must look at this, and I keep saying it, we must declare Lassa fever a national emergency and work for it. That's the only lesson I think we need to learn from there. Over.
Thank you very much, sir.
Thank you very much, Prof, for the wonderful response to those questions. I would be asking these questions directly to Prof Miner. Ma, being a community health person, why does community transmission remain high despite decades of awareness and campaigns? We have done awareness campaigns for years. Why is transmission in communities still so high, ma?
Okay. Well, when you're dealing with communication, one of the basic background problems that we have in this country is the low educational background. And Lassa fever is a disease that affects those in the lower society in many cases, apart from when you're dealing with maybe health workers. So when you have people with low educational background, all other things it's like a cascade. So you find that those are the same people that live in poor housing. They're the same people that live in areas where there's poor waste management and all that. So starting with the fact that the low educational background doesn't, some people think that, going to school does not really affect anything. But going to school is for you to be able to develop critical thinking. So we need to ask ourselves, those people we're giving those messages to, are they really understanding the message that we're passing along with them? I know those in health education have different methods. They use pictures, they talk about giving it in languages. But when you're talking about a country that has over 250 languages, and you have where English is not really a universal language in this country. If you've worked in the community, you'll find it like here in Plateau State, I've gone to communities where there are people who speak only, we consider Hausa a lingua franca, but the truth of it is that I've been to communities where they speak only their tribal language. They don't speak English, they don't speak Hausa as we think here. So if you have a multiplication of that in so many communities, you now start asking yourselves that our messages actually getting across to these people. Why? Because we lack basic education all over the country. We seem to adopt varying patterns of education. So if everybody was going to school in a standard manner, as in it's a standardized system of education, then when you're giving your messages, you can say, okay, fine, I'm fairly sure that everybody is getting this message across. Then one of the other things is, of course, is the language barrier. As much as we try, usually when languages are translated, they are translated into that of the major tribes. So what do you do about the other, very large number of people who don't speak those major languages that we're talking about? I've already, kind of emphasized on that. So you can think of that. Then another thing is the timing. Prof mentioned that it's something that happens every year. We tend to have an idea. Usually it's around the end of the year, around between December and March, that you tend to have the highest peaks. But we're waiting until now when someone has died. People are, I mean, they already have like 700, over 700 cases that have been, suspected cases that have been reported, and over 100 have been confirmed. And then we're now saying, oh, suddenly we're all running around trying to give health education, telling people what to do. So the timing of the communication information, is wrong, is off. We wait until people start dying. Then the other thing is the issue of targeting. Do we target those who actually need the information, regarding that? Are we going to those who are selling things in the market? Are we going to the farmers? Are we going, to those who love drying their things on the road or outside, at night? Because I mean, it's not rainy season, so they now dry their grains, which are some of the risk factors for contracting, Lassa fever. And then there's another group of people that it was interesting that just recently I came across some conspiracy theories regarding Lassa fever, and I was shocked at what some people believe regarding Lassa fever. They think it's an engineered thing. The same stories we have about COVID and Ebola and all that. Because Lassa is endemic, I didn't expect to hear that. But from people who I considered very well educated, who are now spewing out conspiracy theories on how the rats are dropped into our society at a particular time of the year, and that's why. So we have to deal with those conspiracy theories that may not be at the forefront when it comes to Lassa, but obviously are there, and it means that they are going on in the community. Then when you're talking about the health workers, who tend to carry the weight of the fatalities, there needs to be training and retraining. You're having new health workers coming into the system, older ones are phasing out. So we don't just train once and then go and sleep. It needs to be done over and over again. I think there are what we call SOPs, standard operating procedures. We need to have that available for health workers as a communication strategy to them, that okay, when you have a suspected Lassa case, this is what you do. If you go to many hospitals, you won't find anything like that tells you what to do when you have suspected cases. So in the community, yes, and then of course among healthcare workers, which is another mini community, the way we look at communities, there needs to be something that tackles the communication strategies that are ongoing in those health facilities. What do you do? How do you, some people don't even know where to refer those patients to. Like we have a lot of private health facilities that are not sure what to do at that point in time. So if you have standing SOPs in every healthcare facility as a communication strategy on what to do, and what to look out for at that time, I think those are some of the things that are missing in the strategies that we have tried to put together over the years that Lassa has been with us.
Thank you so much, Prof. You've hit the nail correctly. You've talked about the low education and basically the timing aspect of the communications, and also in the aspect of the health workers. The part that actually drew my attention more is the aspect of the healthcare giver, when they basically might not even know or would not know they are dealing with Lassa fever until one or two people have been affected or died before that alarm will be raised, ma. Now, in that aspect, ma, what simple but practical steps can strengthen the primary health care and help communities detect this case earlier?
Okay, well, for the primary healthcare centers, I think I'll still go with the issue that they need to be trained and retrained. Some have been trained, but then retraining needs to go on. And then there's something that I noticed with quite a number of healthcare centers, where usually training, you can't train everybody at the same time. So you train a specific number and expect them to scale down or to step down what they've learned. A lot of those people go for those trainings and come back and just sit with their knowledge. They don't translate it or transfer it to those who work, under them. So that's something that needs to be, looked into, to be able to strengthen the primary healthcare system. There's actually the Emergency Operations Center has done a lot in terms of surveillance and giving information, and all that. But when the job is being, in many places, you find maybe it's just one person. So once that person is not around in that health care facility, nothing gets done really. Everybody else is running around. One, because no other person has been trained. Two, because that person is not available to do what needs to be done. So we need to have many hands that are able to do what one person is able to do. So, and then they have to have a high index of suspicion. I think over the years, a lot of health workers have that done, but I think that still needs to be strengthened, both at in fact, all levels of healthcare, not just the primary healthcare centers. Then for the communities, the primary healthcare system was built in such a way that if you're in a primary healthcare facility, you're supposed to know your community. They're trying to revive that now, but at a point it kind of died, where all the primary healthcare workers seem to be concentrated at the healthcare facility. They really don't know what's going on in the community. What are the environmental health issues in that community? What practices do they have that are enhancing some of it's not just Lassa fever, so many of the ailments that we have around. So I think that we really need to strengthen that, where you can go to a healthcare community, ask them, okay, fine, how many people are under your care? What are the issues? And they can talk without, because primary healthcare facilities are not like hospitals per se, in the sense that they're supposed to be working with their communities to develop how will I put it, like a bottom-up approach, where you plan with the community how to tackle a healthcare problem. So until we get to that stage where we strengthen the communication, between the community and the primary healthcare centers, then you can now find many of our healthcare community healthcare committees are weak. Okay, they're not really as functional as they should be, and they're the ones that are supposed to take decisions for that community. So anyway, so as not to take up much time, but we need to strengthen those community health structures through the community health committees, and then the primary healthcare workers need to really do what they were put there to do. They're not really supposed to be there just to receive sick people. You're supposed to work to prevent ailments in the community in which you are working.
All right, thank you very much, Prof, for that explicit response. And as you were responding earlier to the first question, you talked about leave generally, and we are very aware that this Lassa fever outbreak have been there for over 5 decades now, and is still coming up year by year. The question I want to ask now, Ma, is that what habits or environmental conditions are still fueling this outbreak, and what can we do urgently to effect change in this Lassa fever outbreak that we are having year by year? What is that urgent change that we need to take at community level and every other sectoral level to see that we have a change to this urgently, Ma?
Well, when you talk of environmental factors, I think I mentioned a few as I was talking, but there are some things that we do which is widespread in many parts of the country. One, of course, is the fact that we have very poor environmental sanitation. If you have open dumping all over the place, what you're telling those rats is that you can come into my home. You're inviting them to come nearby because there's a reason why they leave those areas during that time. Bush burning is another thing that drives those rats out of the field into homes or around areas where people live. And then I mentioned the issue of people. I said it in passing that people like drying food outside. If you're driving on the road, you just see they use a part of the road to dry grains, and all that. I'm not sure I really understand why it has to be like why does it have to be on the road? But then even if it's not on the road, it's near their homes. And of course, that gives the rats access. And we know that the feces and the urine of the rats, because the rats are like reservoirs, and they contaminate all these food items. Hence, we increase the transmission. Cultural common in Nigeria, but it exists in certain places, the handling of dead bodies, which is poorly done, especially when you're not sure how the person has died. And in some cases, we know that there's been some unfortunate cases where widows have been made to drink water that has been washed off the body of their husbands in the name of proving that she didn't kill her husband. So that is another cultural practice that, as I said, just present in some certain communities, but it has been known to aid the transmission of Lassa fever. There's another thing, of course, is poor housing. And I mentioned earlier that when we were doing the opening statements, that there's a reason why the people that are affected are the people that are affected. The richer people are not going to build houses that have gaps or have cracks or are made of thatch roof, where the rats can easily get in. Okay, so the richer people tend to be affected lower, as I said, except when you're talking about somebody who is a health worker, because that person is handling patients that come, who already have Lassa fever. But when you're dealing with the community, so you find that those who live in homes that, and then they have poor solid waste management. If you go to a rich person's house, it's not likely to have open dumping around because, it doesn't look nice. So they're going to find a way of handling their waste. But for the poorer communities, you find that, all these things are kind of condoned because they don't have the resources to have the kind of housing that we expect, that they should have. So if you're talking about what can we do urgently now, I think urgently we should improve our socioeconomic status. I don't know if that can be done urgently, but we need to urgently improve. And that still comes back to what Prof was saying regarding the fact that because it's a different class of people that are affected, we are not taking it seriously because the people that are dying are unknown. There are people that are not, really valued, and then even if you're talking about healthcare workers feel undervalued. And I understand, I'm a healthcare worker. Most of us here are healthcare workers. If you've been working in that environment, and you're not being given the proper protective equipment to protect yourself, you're always told to manage. Of course, you feel undervalued. And when resources, it takes a while for when you make a request for all these things to be given, and then you're prompted by your love for trying to help people. You're putting yourself at risk, and then when you don't help, the relations feel that you are, you are not acting on time, you are not prompt, and all that. So on both divides. So I don't. When you're talking about what we can do urgently, I think is to implement what we have in our policy regarding Lassa fever. That is the urgent request, that those things that have been put in writing, we should act on it. We should act on it, immediately. But apart from that, communities, I think, from what we've said, can bring themselves together and begin to put pressure that these things need to be handled. Our waste should be evacuated when it's accumulated. Bush burning should be reduced. There needs to be advocacy for our cultural practices that are allowing these things to, to continue. Improved housing takes a lot of resources and it requires that. So when you say urgent, I think it's just to say we need to act. Everybody needs to act. Everybody needs to be, up and doing for this.
Thank you very much, Prof, for those passionate answers. We're grateful for your expertise and for expatiating so much on those issues. Now, looking at Lassa fever affecting humans and then the animal reservoir, and then looking at also the role the environment plays in the transmission, we see that to be a One Health issue. But then, are we really implementing One Health? Or is it just a rhetoric? I would like both Professor Tomori and Professor Chundung to give us their perspective on that. Are we truly implementing One Health when it comes to managing Lassa fever, or is just something we talk about but we're not really doing? Professor Tomori, maybe you can take that first.
Thank you. Thank you. Again, following up on what Prof has said, I think we need to go back into the origin of this, where I because when we had it before we go to it. It used to be a rural public, and mostly and season, and not only season, you mentioned the rodents are very domestic animals. They don't, when when we have food in the field, they are there. You remember how we used to store drainage around next door to houses in most of the northern parts of the country. So of course, the right can follow, and that's when we start that opportunity is going to. So to begin to talk about the issue of the One Health on the side of it's really, of course, when we talk about One Health, talk about agriculture and all those kind of things, and how each of those different groups play. The way we plant our food, the places where we plant them, how close to our houses they are, what type of rodents we attract, all those things we need to study and to understand. I mean, we have to study on them, but not in details. And the data we have, we are not making good use of them. Now, you ask the question whether there's one health practice in Nigeria, it's only in paper. I've been on different groups, NCDC, LVRI, and they're supposed to meet together, but then it's always fight over who's in charge. You remember when we had the avian influenza in those days? It was the Commissioner for Information who headed it because the physician, doctor, minister did not agree with the agreement. And so the government had to put the Commissioner for Information in charge. A mix of us, I think, on each of us have a specific role to play. I can play the role of the physician as a veterinarian. The physician cannot play my role as a physician. But without me,
Sorry, Prof, to cut you. A few of the people said they can't hear you very well, so maybe you can adjust closer to your mic.
Can you hear me now?
I can, but let me see if others can hear you. Please, can we respond if you can hear Prof very well?
Can you hear me very well?
It's echoing.
Not so clearly.
Well, whatever it is, let me just quickly say what is that. Each of us has
can hear him.
Okay. Each of us has a role to play in One Health. And it is for you and I to understand your role. When you are the expert in your role, I can be an expert in your own side. So we bring all these entities together. All we're getting is strong local leadership in One Health in Nigeria. And that's how we're not making use of the different carriers. I mentioned earlier on, as a veterinarian, I can't do the work of the physician. The physician cannot do my work as a veterinarian. But each of us is an expert now, the environmental scientists, all these other people, they know their own different areas. We should pull all these resources together to make it truly One Health. It's not that one person takes charge of the One Health, to the detriment of the expertise of the others. That's why we're having a failure. NCDC is actually the one that's supposed to be handling One Health in the country. But it's supposed to be a kind of triumvirate thing, just like the WHO, the FAO, and all those ones have a triumvirate group to run One Health. That's the way we should run. There's no, when you have equal partners, that's what it should be. Not one person in charge and then to the detriment of the other. Because we're not beginning. So we're not practicing One Health the way it should be practiced. That's the summary of it.
Thank you very much, Prof. Back to Professor Miner.
Okay, just to add a little that we tend to work in silos, and that's what's affecting One Health in Nigeria. Mind you, One Health is actually kind of a recent concept, but it definitely is a needed one. It's not because for long, it's like those handling animals are on one side, those handling humans are on one side. Then we have the environment connecting all of us. I mean, we talk about zoonotic diseases, but there was never any real collaboration. So I think we need to abandon those silos that we are working in, which is what is hampering the implementation of One Health in in Nigeria, and create opportunities for discussion amongst the different health sectors. And then when we're talking about health sectors, we're not just talking about veterinary doctors, medical doctors, and all that. You're talking about the people who are working in the agricultural industry. You're talking about those who are handling food. You're talking about those who are managing waste. You're talking about those who are inspecting how houses are built. Okay, so the architects, the engineers, you're talking about all those groups of people. So I mean, I am not the one that is going to be chasing or setting up rat traps or stopping bush burning, because that's not where my field of expertise or my work is. So if we don't recognize that there are people that we need their assistance or their help to be able to achieve these things. So One Health is not just about just the veterinary doctor and that and all. In the environment, there's so many actors that need to come into play so that we achieve what needs to be achieved. Earlier on, I mentioned the issue of poor education. So it means you're talking about teachers, as well. What is their role in educating people and ensuring that the message is translated properly? When you're doing communication messages, you now have to look for people who are trained in communication. Some of us have some training, but there are some that's their life's work. They've been trained in how to communicate. They are the ones that know the tools, they know the communities and all that. So it's actually a big job. But since we're all fighting in our little corners to be recognized, Lassa is having a field day because we're busy fighting one another or not allowing ourselves to let go. Unfortunately, anytime people come together, somebody has to lead. So maybe we need to agree who needs to lead, but all of us need to agree that we need to work together to ensure that this is done properly.
Thank you very much, Professor Miner. Over to you, Adamu, to take us through to the next segments of the questions. Adamu, are you there?
All right, thank you very much, professors, for answering us effectively. My concern or the next question I'll be asking, when Prof started talking, he said, we are not serious as a country, and until the House of Assembly, the President, the Senate, and the rest of the government and policymakers are affected, that is when this Lassa fever issue would be taken serious. Now, the concern right now is lack of political will the real issue? If yes, how can we ensure our leaders stay committed, our leaders and policymakers stay committed, even when there is no outbreak of this Lassa fever? Because we understand how we were able to curb COVID-19 because it affected everyone. From Prof Miner's response, it seems Lassa fever is a common outbreak of common disease right now because it mostly affects the poor people or the people that are not really in urban communities or not very influential people. So how can we be able to get these policymakers and leaders stay committed even when there is no active outbreak for us to be able to completely eradicate this Lassa fever in our country? We'll start that from Prof Miner, then Prof Tomori will speak after. Thank you.
Okay, maybe let me clarify something before we go away thinking that it's only poor people that are dying from Lassa. We've said that the rats, which specifically is the Mastomys natalensis, if I can go that far in the subspecies, the multi-mammate rats. Now, these rats are attracted to the reason why it becomes more during that period is because they run out of food. Everywhere is dry. They can't get food in the field, so they start coming closer to our homes and all that. One of the things you need to realize is that our markets are also not secured. So as much as you would want to think that it's a poor man's food, all of us are going to that same market. So if a food item has been infected in the market, and even if you're a rich person and you buy, that's why Gary is such an important issue with Lassa fever. You buy your Gary and you drink, because Gary, hardly do we, many people drink it raw. You know, they take it raw, they don't cook it, and all that. And that can be a link between that. And then we still have so-called rich people that rats can get into their home. But proportionately, when you follow up those who tend to come down with the diseases, we tend to find more of people from rural areas, from the poorer socioeconomic backgrounds. But, you know, just as Prof Tomori had said, I have also lost friends who and colleagues who died from Lassa fever, and a few of them, it wasn't from the hospital that they picked it up. So let's not keep thinking that, oh, it's just poor people that are going to come across that. So in terms of political will, I think we ourselves as a people have to rise up and scream. I don't know whether shouting is enough anymore. Maybe we need to scream, really scream, that please, can somebody come and help us out of this hole you know, that we're in. And how do we scream? We have to scream by holding our legislators, holding our House of Assembly people, holding those working in Ministry of Health, you know, accountable. We need to put pressure. And I think one of the things I've seen working recently is social media, where you find that if you make a lot of noise on social media, all of a sudden, you know, it's like somebody listens, you know, listens to us. So yes, that is, you know, that's there. When, you know, sometimes I worry when we focus on only one disease. You know, sometimes as specialists, you kind of end up being focusing on one disease. But the truth of it is that if we handle some of those basic things that we're mentioning here today, so many diseases will disappear. If we're having safe water, if we're living in good housing, if we're managing solid waste properly, if we banish open defecation, if we banish open dumping, you'll be surprised the number of diseases that we're battling with, malaria, typhoid, that will suddenly just disappear into thin air. You'll be wondering, where did all these diseases disappear to, you know, and all that. So one of the issues I've noticed in Nigeria is that you can be rest assured that there are policies for all these things. There are laws against open dumping, there are laws against open defecation, there are laws. Implementation is where our problem you know, comes in, and implementation requires funding. It requires funding. If you don't fund those who are supposed to pick up waste daily, if you don't fund those who are supposed to clear our gutters, if you don't fund those who are supposed to supply PPE for our health, if there's no funding available, it's going to be a problem. Professor Tomori mentioned something in passing when he said that our allocation of resources is what we need to look into. But as a people, I think it comes down to us putting pressure. I think we need to put a lot, and it comes by advocacy. It comes by, as I said, screaming, be it on social media, be it on newspapers, you know, and all that. But many of the things that allow this disease to continue require a lot of funding. We can't just, he mentioned that it's not control we should be focused on. This is a very preventable disease. But as long as we're not taking care of those environmental factors that allow it, is going to continue. So advocacy is usually what we talk about, and then enforcement of those laws that are already in place to ensure that things are taken care of. And then another thing I didn't mention earlier was the issue of deforestation. As we're expanding, we are making those rats homeless, so they will keep coming to live with us. So that needs to be addressed, the issue of deforestation. Yeah. So I think you know, I don't know whether I don't have all the answers. Maybe I'll allow Prof to talk, because the method in which we will put pressure on the government, I think, is where you know, we really need to talk about.
Yeah, thank you very much.
Thank you.
Thank you. You've talked on. Can you hear me?
Yes, sir, we can hear you.
Yeah, thank you very much. Thank you for the aspect you brought up. The fact is that, as you mentioned earlier, It's not that we don't have the policies for all those. It's implementing them that is a problem. All of the recommendations that we're talking about now, we said those recommendations way back in the 70s. The same thing we said at that time. We're repeating them 56 years later. We just will not implement all those things. So there's no need reinventing the wheel. All the rules, all the regulations are there. It is to go take a step further. So when you talk about political will, I think the political will is a campaign thing. They will only hear about what the government is going to do when they are campaigning. When they get there, they don't even remember what they told us they're going to do anyway. So it's left for us, just as has been said. We have a role to play. You young students, I've been a student about activist since my days in ABU. And I'm still talking because the problem is not over. And so you young people too, you have to get involved in what is going on. It's not an old man. There's so much more energy than I have now. You can do that, but we can give you the backing and the support. So you need to come out and get involved in the welfare of your people. It's not, this is a good meeting that you're doing now. I'm hoping we're going to get some comfort from you and say to the people, those of you, all of us, do you know who is representing you in the House of Representatives? Do you know who, even in your own state, do you know who is representing your state House of Assembly? No. We sit down and keep complaining. We don't talk to people that we should be talking to. And if you a little bit of check, this is the officer who's in charge. And I'll give you a good example of one of the things that happened here. I live in a part of Ibadan here. Well, as been said before, good housing and all those things will reduce the amount of rats you have. Even in the best of Lekki and the posh area of Abuja, they still have rats in their houses. But the number of rats they have will be limited compared to in other places where the rats are sleeping with the people in the rural areas. So let me put it this way, that it is not enough for us to see what you and then keep quiet. Follow up on all those people. Political will must be followed by political commitment. Our leaders stop at political will, which is what they say during the campaign, and they don't commit after they get in there. It is our duty to go and find out, follow up on that. It's our role for our people, for the environment we are living in, even for ourselves. The doctor that died of Lassa, she didn't know where it came from. So we are all involved and we're all affected. So we must take it as a problem that for all of us, get to your community leaders, get on to the representative. What are they doing? Where are we? And unfortunately, many of them don't even know what is going on. So because we're not giving the right information to them. And many of us also, when they come and tell lies to us, we are clapping and giving ovation when we know they are telling us lies. Come out openly, say what needs to say. Courage doesn't kill anybody. It may cause you some problem. But I think, let me show you that I'm a living example. I carried a coffin in ABU to go and demonstrate before the military. I'm still alive, but it's not everybody that will be like me. I don't say you should go and do that now, because if you send such, the police wipe you out before your time. But a certain thing, we need to put some courage into some of the things we are doing. It's not just talking on this platform like that. Let's move on from there. Get your force together to go out to those people. Know your representative. Bring all these issues to them and say it. We keep saying it and we continue to say it unless it's something they see and they will affect them. We never do anything about it. So, my friend, it is for us to take all these things we are talking about now, move forward from here, go out and reach out to the people who are representing us, so that then they know that they know that they have the duty to do. Sometimes they don't know. It's us that will make them know. Over.
Thank you very much, Prof. Yes, we can hear you, sir. So you began to address some of the things that we were going to talk about. So beyond awareness campaigns, right? You began to talk about that for the students and early career professionals. What other things can we do actively that would be able to get results when it comes to the addressing and tackling Lassa fever? Just beyond awareness campaigns, what other things can we do? Maybe Professor Miner can shed more light on that as well.
Thank you very much. I think, first of all, it starts, I think, from educating ourselves. If you don't have information, you won't be able to address some of the things that may come up. So whether as students, as healthcare workers, we need to educate ourselves. And I think if you educate one person, there's that room for you to also educate others on how they can protect themselves. Just as Prof said, there are in some houses may not be as much as in others, but there are simple measures that people can take to ensure, that they protect themselves from Lassa fever. So at the individual level, things like ensuring you reduce rat populations around your home, ensuring that the food you have rodent proof containers. That's containers that are not that don't allow exposure to these rodents in within your homes, even though once again some of those things require money to do. And then when you have any of those symptoms that suggest you quickly ensure that you contact a healthcare provider so that you can be directed appropriately. Well, as we've said, the healthcare providers too need to have a high index of suspicion. The other thing is, as I mentioned earlier, pressure groups. As I think students were well known as forming pressure groups, before. These days, it's not as strong as what I remember when I was in school. There's this culture of not speaking truth to authority that I see these days, which I think is unhealthy. But as he said, maybe the NSAS protest has kind of scared a lot of people. But I remember during our time, it's not as if I'm that old, but during our time, I saw more boldness than what I see now. I see a lot of bowing to authority, people unable to speak their minds. We just clap and go, and nobody says the truth. And some of us actually are relations to some of these people that are policy makers and decision makers, and we are unable to talk to them. Maybe we're thinking that they will cut off our funding or something. I don't know, but some of us are unable to do that. So there's some strategies at that level. They are harnessing individual relationships, harnessing or leveraging the positions that you find yourselves in to be able to do these little things before you talk of larger pressure groups that are able to advocate for for these things. So students are in a good position to do that. Some of us are also in very good positions to be able to organize pressure groups to take action. And as we've said, hold people accountable for those promises they make to us, and bring it to their awareness that, okay, this is what is happening. And then we're not making use of the data that is available. I mean, if we're just in February already, how many people have been diagnosed and how many people have died? I mean, maybe we're thinking these lives are useless also, as Prof said, maybe because we've not heard that a celebrity died or somebody in house of rest, but that one life was somebody's brother, sister, mother, and it's actually, it's in some cases, the person is the breadwinner, and you put a whole family in poverty because the breadwinner has died because of that. So there are implications to not handling these things. Maybe we're just not looking at those ones. So thank you.
Please allow me to make one more comment about positive activism. In the veterinary, we had the first veterinary open day in ABU in 1970. And the student group, veterinary student group, got together. What are we going to address? We're going to look at, we went into what are the problems, and we're looking at meat inspection. And what did we do? We invited the Minister of Agriculture, the Director of VOM, Director of this, to come into ABU for the veterinary open day on the theme meat inspection. And I see a few days ago, I was looking at the New Nigeria edition of 1970, in which I was looking quite young then. I didn't have any gray hair. I saw my picture as the president of the Veterinary Student Union, in which we did that kind of thing. Nowadays, that's what I think you should be looking at. As students look at your environment, what are the things that need to be done? and call all the big people to them, come and show them. Because like I said, they may not see all those things when they're flying in their entourage or flying from one place. You are the one on the ground. You see what is happening to people. Bring this up to them. Invite them as special guests to come into this thing to talk about those things. And you let them know what is happening. And when you give your keynote address, let them be there when you give it. Don't give it after they have left. These are things you do to draw attention to what is around and being positive using because your knowledge, your research actually should start from the market, from the environment. Nowadays, we think about the research for the market. Actually, the market should be the place where you begin your research so that whatever research you do can be relevant to the needs of your people. So positive activism, getting to know your people, understanding what the problems they have, and getting what you have now to bring all that together so that you can make a positive end to what is happening. Over.
Thank you so much. That was very, very powerful. Prof Miner and Prof Tomori. At student level, we look into some of these bold comments made and we'll take those bold steps going forward to see how we can do more aside the campaign. Thank you so much for that wonderful response. Now, I would like to ask both of you to answer these questions briefly. I would start with Prof Miner. In the question should be answered in one or two sentences so that we could have like a take home from all that have been said so far, because a lot have been said, a lot have been noted. We understand the challenges now and we understand what needs to be done. Now, Prof Miner, what must change immediately?
I would say everybody's attitude, the populace and the government. That's towards Lassa fever.
I agree with you.
All right, thank you very much, ma'am. We'd like to hear Prof Tomori's own.
I've already agreed with her. There's no need to say change of attitude by everybody, all of us. Thank you.
Thank you so much, sir. Prof, I will be starting the next one with you, Prof Tomori. If you could implement one policy tomorrow.
Sorry, go ahead.
Sir, can you hear me? I said, if you could implement one policy tomorrow to eradicate this Lassa fever, what would it be, sir?
I will not aim for eradication. I will aim for control. Because of the vector concern, it's not just the mastomys rat that is involved. There are also other rodents who are involved. If I'm going to eradicate, I will have to eradicate every rat in the world. So we aim for control. And that's, I think, the message that we need to get to. So take this in step by step. And then implement what is achievable. And then you can move on to higher steps. So right now, the point is, let's control the disease. And how do we do that? Be on the alert. We know when it starts. We know when it ends. Prepare ahead of time. Most of the cases start in October, November, December. By July, we should begin our preparation for these cases, alerting people, letting them know that this disease is coming, do something about it. Take care of your house, remove the rodents, all those kind of things. Those are the messages, and constant message to our people. A proper message, ideally put into the people in such a way that they will know a good understanding of the transmission of the disease and intervening at each point to break that contact between rodent and man. Over.
Thank you so much, Prof. Prof Miner, can we hear from you?
I think just to add one we should enforce collaboration across all agencies that are involved. Just to add to what Prof has said.
All right, thank you so much. The last question is, what is one misconception Nigerians need to unlearn about Lassa fever? Prof Miner, we can start from you.
I think they must unlearn that they are immune or that I cannot be affected. Because if you believe that you are at risk of Lassa fever, you do whatever it takes to ensure that you don't contract it. So you must know that you are at risk, no matter who you are.
Yeah. You want me to add to that?
Yes, sir. Yes, sir.
Let's look at we also mentioned about the cultural thoughts and beliefs about Lassa fever. In 1989, when we went to investigate the outbreak in Epoma, we were sitting at the parlor discussing with the people, and one of the teachers actually said, this Lassa fever, now wincho, which is a witch. That what the person do. And I said, it's not the witch. I said, it's brought by a rat. Say, the witch can become anything now. It's the witch that turned to the Reuben that is coming to do this. So we need to have proper education to convince our people. They still believe some of these things. They don't believe in all these things we're saying because, like maybe Dr. Miner, Professor Miner said, people drying food on this. How do you relate that to Lassa? It's difficult for them to understand. So we must get this type of information. This practice you are doing can lead to you getting Lassa. And when we have good examples of that happening in places, we should bring these stories up to our people so that they can see what it is. When you come up and say, do not eat bushmeat, that's half the story. The man who is eating the bushmeat in Bukateria is not likely to get Lassa. The person who is going to get the Lassa is the one who trapped the rodent in the bush. The woman who is treating the raw rodent. Those are the ones that are getting Lassa. But then they can get Lassa and bring it to the man who is eating in the bukateria when the meat is already cooked and there's no Lassa in there. So when we relate all this down the line and just say, stop eating bush meat, it's an incomplete statement. It goes beyond that. Who is trapping it, who is preparing it, and who is eating it? And if the man who is eating thinks it's free, let him remember that who is preparing, maybe it's even his wife, or you can contact the hunter who is doing it. So that way, let's link all this together and tell the full story from our people rather than give recommendations that only have solved the problem. Over.
Thank you so very much, Professor Miner and Professor Tomori. So in conclusion, we would like to know if we meet in 2030, what must be different in Nigeria's Lassa fever story? Just shortly, Professor Tomori, would like to start with you.
If we meet in 2030, which I pray we do, because I want to live a little longer, what do we need to do? That we have reduced the number of cases of Lassa fever, that doctors and health workers are not dying anymore, because all the necessary things they needed. And there are people also, we have upgraded the status of the life of our people, that they are not surrounded by rodents and other things. Those are the things that I think we bring it. So we reduce that one, we provide enough facilities workers to ensure that they don't get unnecessarily exposed to this thing. And so we can totally reduce from the 1,000 cases we're getting to less than the single digit number. Over.
Thank you very much, sir. Professor Miner.
Thank you very much.
Okay, I stand with what Prof said, but I'll talk in epidemiological terms. In 2030, I would like to see an epidemiological trend where Lassa fever is on a downward spiral rather than heading upwards as we're currently seeing. Thank you.
Thank you so very much, Ma and Sir. Over to you, Dr. Adamu, to take the question session for those who have stayed with us through the discussion. Thank you.
All right. Thank you very much, Dr. Jennifer. Thank you, Prof Miner and Prof Tomori, for the wonderful insights shared so far. To our audience, thank you for staying with us to this extent. And I know they've said so much that you have some questions, comments to want to say to them. So we'll be taking the question and answer session now. Please, if you have questions, kindly indicate so that I would call you. Then we'll all take the questions. Then Prof, you address your question either to Prof Tomori or Prof Miner, so that when they want to respond, they will get to respond to the questions accordingly. So we would like to take the questions now. If you have a question, just signify, then I observe you.
I think there are questions on the chat group. Professor Tomori has answered one or two that I saw. So maybe we can go to the chat group. Well, we don't have too much time, so maybe we'll just take a few of the questions. Thank you.
Okay.
Can I just make a little comment? There was this question about cat and whether
Yes,
we
sir.
can use that to, yeah. Again, to me, let me put it straight this way. Cat is control. Making sure rodent doesn't come in is prevention. And we know prevention is better than control. There's only so much a cat can do. If you remain in your filthy environment, the rodents will overwhelm the cat eventually. So your best bet is prevent rodents in your house rather than begin to look at control. Just as I was saying, NCDC should change their name to National Center for Disease Prevention and Control rather than disease control. And then they forget the prevention. And that's where we are today. So in any approach we do, let's do prevention first. Then it will be easy to control what cannot be prevented. Over.
Thank you so much, sir. Another question on the chat box is is there peculiarities to the type of rat that harbors the virus, Lassa fever virus?
Sorry, if I may say something. I think Professor Tomori has responded to that, both on the chat and then while he was speaking. But I just want to, like a follow-up question to the question on the cat. Professor Tomori, sir, in a radio, on a TV talk show, I was asked, it was a call-in meeting. People call and ask questions, and I responded way back, I think 2010 or so. And these are people from the communities, and I couldn't believe that this layperson could think of this kind of question. So she asked, she said, what if you have a cat and this is a pet cat, but you allow it to go out and it can go and maybe eat a Lassa fever infected rat. What if that occurs and it comes back home and then you carry it and you're petting it? Is there a possibility of you getting infected by that rat? So I want to hear Professor Tomori answer this question because I want to know how well I answered that question. Thank you very much, sir.
Thank you. The cats don't have any, they are not listed as one of those who can get Lassa fever. So they assume they will eat it up, and that is, but however, if it's a matter of how quickly it's contact. Correct. If the cat mauls the rat and it's still fresh in his mouth when he gets back to you, the likelihood is there. It's not impossible.
Yeah.
I mean, and that's the way my reaction is that what are you contacting? What are you taking? There was a story about people getting COVID from their pets during the COVID era. So it's a matter of contact. But the chances, to me, are quite, because cats being what they are very clean animals. When they eat, I'm sure they clean up. But if you manage to get it as soon as it finishes and that particular rodent also has virus, there's a possibility that you can get. But all this is within the realms of possibility. There's no hard and fast rule about it. Circumstances can make it, whatever. But for me,
thank you very much, sir. So they are serving as vehicles, more or else, in that situation.
They are not
not as reservoirs. Correct.
Exactly. Dr. Jabbar. So that's
Yes.
the
So it means since the professor of Lassa fever has answered like in this manner, that means I got 100 over 100. Thank you very much, sir.
got 150 upon 100.
Thank you. All right. So any other pertinent question? One more pertinent question that we can ask so that we can close because it's 9:30 so that people don't start sleeping on us.
I think
Thank
someone
you
asked
so
about the
much.
treatment. I think that one is important as to whether the treatment is free. So yes, the treatment is free if you're being handled in a public health facility. So usually they would contact the whichever agencies, whether your EPID unit or EOC or that is handling it in your state. So yes, ribavirin, which is the drug of choice, is given to both the person affected and the contacts. Did you hear me?
It's faint a little, but we
Sorry.
can hear you.
Yeah.
Okay, I think there's one question here. Either of you can answer. What measurable indicators should define outbreak preparedness in endemic states, and are those benchmarks currently being met? Professor Miner, maybe you can start to respond.
Sorry, can you repeat that?
Okay, the question here says, what measurable indicators should define outbreak preparedness in endemic states, and are those benchmarks currently being met?
Okay, when you're talking about, Lassa fever is endemic. So throughout the year, you get, you get cases. So when we say an epidemic has occurred, is when you have cases that are above what obtains during the year. And those are the benchmarks that are actually used to determine that an epidemic has occurred. But the thing with Lassa fever is that over the years, we've seen that it's at a particular time of the year. We already know that there's a particular time of the year. We didn't go into talking about why it happens at that time of the day, but it has to do with, as I said, no food. It's the breeding time for the rats. People are they're drying out grains because it's dry season, and also all those ones play a role. So you can still look at those as indicators, as in the weather itself is an indicator that we're about to have Lassa fever. But if you're talking about measurements, once you begin to get cases that are above what we would get during other times of the year, that is an indicator that yes. But I'm not sure it's something we need to be waiting when we know that it's a certain period that favors the transmission of this. I think the virus even survives better in the dry season than the rainy season. That's another thing that aids its transmission. So I don't know, but those are but if you're talking about indicators in measurable terms, it will be the number of cases or suspected cases that are being seen in health facilities and are being reported, because underreporting is another problem that we have.
Yeah. So in addition to what Prof has said, I think one of the things we need to know that Lassa fever occurs in this country throughout the year. Go and check the records. Every month we report. But we have upsurges, and there are factors responsible for the upsurges. Immediately, the contact between man and rodent is increased when the environment, because like dry season, the rodents leave the farm and come into the house. We store grain at that period, enough food for them, refuse and all that kind of thing. So that increases the contact between rodents and man. So there is a great measure of how many cases we get more. In the rainy season, the rodents are not going to stay in your house much because there's food in the field. As I mentioned, they are perid. Under normal conditions, they would rather be in the field when there's food and other things. It's only when there's no food there that they come into the house. So that's increase in the contact between man and rodent is what leads to the upsurges that we have. So rodent, Lassa fever, of course, according to NCDC data, It occurs every month of the year, but we have these major peaks in the dry season. There was this question about outbreak response, I think, outbreak preparedness. You know, the only thing you can use for outbreak preparedness is like a student studying for an exam. It is after the exam comes that you know whether he has prepared well. Outbreak preparedness, the only thing that I mention is, are there outbreaks or are there outbreaks? Because you prepare well, there should be no outbreak. So the answer to outbreak preparedness is measured by whether you have outbreaks. So when you look at that with Lassa fever in Nigeria, outbreak preparedness is zoped. I don't want to say it's zero, but it's close to that. Because if every year you're getting more cases than the year before, then your preparedness is useless. Over.
Thank you so very much, Professor Miner and Professor Tomori, for shedding more light and sharing your wealth of experience with us throughout this engaging conversation. I trust that every participant has learned and is beginning to look into ways that each and every one of us can contribute to controlling this deadly disease that seems to be affecting more and more people as the years go by. So I'll hand over to Professor Grace to round up the session for us. Thank you very much for staying through. Professor Grace, ma'am.
Thank you very much, everyone, for being part of this wonderful dialogue, especially our Professor Oyewale Tomori. I'm sorry if I'm slaughtering that name. Professor Oyewale Tomori. Very unique name. Thank you, Professor Chundung A. Miner, for attending this meeting, accepting within a very short time and being part of this meeting. Thank you so much. We are very grateful. And I see some of our elders, Dr. Doda Marie. Thank you so much, sir, for all the encouragement you have been to us as an organization. Thank you to, so many people I can't call them. I can't call the name. I can't call them out. So many wonderful people that have made it here. We are so grateful. I hope that next time when we call you, you'll make it. Sorry we took more than an hour, but I'm sure you all enjoyed it. And we wish we could have heard your voices individually, but the time wouldn't permit. So nevertheless, please take note. There's a YouTube link that I've posted so that you can go back and watch this same meeting tomorrow or next and share the link to others to also benefit from it. There's so much that we have learned. So much. Wow. So we have been given a lot of a few assignments, key assignments, and I hope we get to do them. I'll also try and see how each of you that have registered will send you the AI summary or minutes of the meeting as a follow-up as well. Thank you so much, Dr. Jennifer. Thank you, student Dr. Adamu Abubakar, for moderating this meeting. Thank you, my team, for the great work. Theophilus, Tunga, so many of you, the communication team, you guys have been awesome. Thank you so much for being here. And we look forward to seeing you again. Please drop very encouraging comments and drop comments on the YouTube page that will help us move forward. Thank you so much. God bless everyone and have a great night. We love you. Thank you so much.
Bye-bye, Grace. Bye-bye, Prof. Chundung.
So,
Bye,
Prof. Bye.
Bye, Prof.
Good
Tomori.
night. Thank you, everyone.
Really nice
Sleep
having you.
well. Have a nice night.
Yeah. Good night.
You all make me
Grace.
feel younger. All of you.
Bye. Good night. Thank you.
Good night, everyone.
Good
After
night.
this week, it has gone down by 10 years.
Why? Expatiate, Prof.
All right, well, have a good evening. Sleep well, everybody.
Okay, good night, Prof. Have a nice rest. Thank you so much for coming.
All right. Good night.
Okay, so Chundung, Mungo de fa
Thank you
Alampada.
so much for inviting me.
Thank you for your time. Thank you for the knowledge shared. Okay, Prof is still here.
I see no Mungo Day, but if I tell you the other one I know, you won't talk to me again.
Eshegon.
Inasonka, that's the one I know.
Oh, Nasonka.
Bye bye,
You should say Nasonki.
Isonki, sorry. Okay.
Oh, Prof.
Bye bye, everybody.
bye bye, bro.
So, now go there.
Kachifori.
Oh, Prof. Kobo. Are you surprised?
Honestly.
I'm a true Nigerian. I'm a true Nigerian. Oh my goodness. Bemi Sola, Asondua, Augustine, thank you so much for attending. Momo Sunday, thank you for attending. Chizaram, thank you for attending. I'm going to keep doing this until you guys leave the call. Chris Izoma, Samuel Matthias, thank you for attending. Jerome, Michael Sati, wow, thank you for attending. Dr. Marie Mipengo Diano Nomdorun in Java. Gurumyen, thank you so much for attending. Oh my goodness. Abubakar, you're just smiling. Oh my God, Prof. Obame is here. He attended. Wow. Prof, thank you so much for attending. I'm just seeing so many wonderful names. Amina, Yunusa, thank you for attending. Hagai, Diga, thank you for attending. Dagwam, Mavren, Zumsti. Wow, we're blessed with names here. This is a Nigerian name, right? Yeah. Something funny happened. Some of my Ethiopian friends from a CDC group that I belong to joined an hour before the time. I don't know if they were able to join back after leaving. Amin Adeshino. Thank you for coming. Asmao Anka, thank you for coming. Halidu Musa, thank you for coming, for attending. I'm saying coming as if it's an on-site meeting. Yeah, thank you for attending. Franca, thank you for attending. I'm enjoying this. Adesimi, thank you for attending. There's this name I'm seeing dry. Wonderful name. Thank you for attending. Augustine Tunga, once again, thank you for attending. Goodness, George, thank you for attending. You guys, I hope you guys filled the form for those of you that need assistance. Asma, thank you for attending. That name sounds like a Kogi name. Olonitola, Damilola, thank you for attending. Nice seeing you here. Amina, thank you for attending. Muhammad Abdullahi, for attending. Ismail, fasting starts. More grace to all of you fasting tomorrow. More grace to pray for the nation. Ismail, and I seem to have not called. No. Is there anybody? Thank you for attending. Good night.
Yeah.
All right. So you guys, good night. Have a nice rest. Gloria, all the best. All the best. Oh yeah, bye-bye. Bye-bye, everyone. Asondua. Thank you for attending. I think I've called her name. So I think I've called everybody's name. It means it is bye from us at WARF, War Against Rabies Foundation, Chip Talk Africa. Do have a great night. Thank you so much. Bye, everyone.
Good night. Thank you.
And everyone, bye.
Yes.
Thank you so much. Love you guys.